Ladies and gentlemen, happy Ramadan. Today we'll discuss an important subject for fasting patient as regard chronic liver disease. Chronic liver disease is an important disease in Egypt. Most common causes for chronic liver disease is viral causes such as hepatitis C virus or hepatitis B virus, and hepatitis C virus is endemic in Egypt and considered as a common cause for chronic liver disease. About 20% of chronic liver disease is due to hepatitis C virus. Also, chronic liver disease may result from other causes non-viral, such as autoimmune cause, and may be due to drug, may be due to metabolic disease such as Wilson disease. These are the most important causes for chronic liver disease in Egypt. As regards the clinical presentation, the patient suffer from chronic liver disease may be suffered from vague symptoms such as general weakness, easy fatigue, hypersomnia, edema of lower limb, and also may be suffer from specific lesion such as yellow coloration of the sclera, dark coloration of urine, abdominal enlargement. Also, patient may suffer from coma sometimes. Considered as an important complication for chronic liver disease is hepatic coma, and it is one of the major presentation. Also, patient with chronic liver disease can be suffered from serious complications such as hematemesis, vomiting of blood. A patient with chronic liver disease can be diagnosed by ultrasonography, by liver function test, and also importantly to exclude viral cause serologically to detect hepatitis C virus antibody or hepatitis surface antigen for B virus. As regards the complication and the management of patients with chronic liver disease, at first should be considered the patient with chronic liver disease into, or can be classified into three groups: group 1, group 2, and group 3. And patient with group 1 have good general condition, serum albumin more than 3 grams, no ascites, no edema, and patient can be considered in group of compensated liver disease. Also, patient with group 2 can be considered as a compensated liver disease, but more marked than type 1. As regards type 3, this is considered as non-compensated liver disease, and patient may present it as there is in laboratory finding albumin below 3 grams, increased serum bilirubin, increased prothrombin dime, and the bleeding tendency. The patient with group 1 and group 2, this patient can be fasting Ramadan, but under observation, good observation, and patient should be taking good glucose intake at the beginning of the meal. This patient can follow up correctly with the doctor to avoid progression to group 3 from fasting, and should be continue in the medication, but can consider fasting Ramadan. But patient with group 3 cannot fasting Ramadan because this patient cannot tolerate the long time of fasting and should be take the drug and should be take the meals, and so cannot be considered this patient fit for fasting Ramadan, and patient with group 3 should be avoid at all to fasting Ramadan. As regard to patient whatever type 1 or type 2 or type 3 when considered or subjected to complication, such as patient start to be develop pre-hepatic coma, and at that time patient will start to suffer from insomnia at night, bleeding from nose, drowsiness, inability to speak, and then patient pass to coma. This is considered as neurological manifestation of chronic liver disease, pre-hepatic and hepatic coma. This patient should be stop fasting at all, and should be patient admitted to hospital and start to take treatment, and this patient with pre-hepatic coma not fit for fasting Ramadan. Also, patients with chronic liver disease, when subjected to serious complications such as vomiting of blood, and vomiting of blood result from esophageal varices due to portal hypertension, and this patient may be range from mild hematemesis to severe condition. Patients start to suffer from pallor, dizziness, sweating, and vomit of blood. And this condition, patient should be admitted to hospital to receive medical treatment. And this patient are not fit at all for fasting, and patient should not fasting at all for the last time after the attack of hematemesis, because this condition is so serious and may be fatal to the patient. As regards to chronic liver disease, due to non-viral causes, autoimmune disease, or due to Wilson disease, this condition can be assessment according to the clinical state of the patient, and patient with mild attacks of autoimmune hepatitis can be fasting Ramadan under clinical observation, but patient with chronic liver disease due to autoimmune hepatitis with severe manifestation, like patient with arthritis or even glomerulonephritis, and this patient can be detected in the investigation by finding autoimmune antibodies in the serum of this patient. A patient with marked condition, especially in presence of renal affection or glomerulonephritis with the chronic liver disease due to autoimmune hepatitis, this patient is not fasting to Ramadan because he needs a lot of water and need to take medication all over the day, and this subject or this patient cannot fit for fasting of Ramadan. As regards acute liver disease, it is different from chronic liver disease. Acute liver disease most probably due to hepatitis A virus, maybe due to hepatitis E virus. And this virus A and E virus transmitted through oral fecal route and usually occur in young age or young people. A patient with acute hepatitis due to virus A or virus E virus will be suffered from yellow coloration of the sclera, dark coloration of urine, abdominal pain, vomiting, mild fever. On examination there is liver enlargement, and it can be diagnosed also by ultrasonography and by serological marker for hepatitis A virus, IgM, IgG, or for E virus. And this patient with acute liver disease, most probably due to viral infection, not fit at all for fasting Ramadan. Patient with acute hepatitis due to virus A or virus A can be diagnosed as mentioned before through ultrasonography or through serological marker for hepatitis E and hepatitis A. Also liver function test is important, such as SOGOT and SIGEP, serum bilirubin. Patient with acute hepatitis not fit at all for fasting and should be stopped fasting at all, because the patient with acute liver disease need rest in bed, a lot of fluid, frequent meal, small frequent meal, and should be take the drug frequently. So this patient cannot fit at all for fasting Ramadan with acute liver disease. Acute liver disease may be result from another many causes, but the most important causes in Egypt, especially in young age, is virus A and virus E. Maybe drug induced, maybe due to autoimmune or other causes of acute liver disease. So lastly, can be considered chronic liver disease with compensated liver can be fasting Ramadan. Patient with chronic liver disease and not compensated cannot fasting Ramadan. Patient with acute liver disease cannot fasting Ramadan and should be stop fasting for this condition. Thank you.
mosque of Abu Bakr ibn Muzhar is situated in one of the oldest districts of Cairo, the district of Al-Husseiniya, downtown Cairo. This mosque was built by Prince Muhammad ibn Abi Bakr al-Ansari, known as Ibn Muzhar, in 860 Hijri. He promoted in the official offices till he occupied the office of the Chamberlain of the Governor of Egypt in 893 Hijri. Abu Bakr ibn Muzhar learned the Holy Quran during his childhood at the hands of the very famous Imam Shams ibn Qasim. Was at first a religious school for a while, but afterwards it was turned into a mosque. It consists of 4 halls. The eastern hall contains the prayer niche and the tribune. The hall was roofed with marvelous decorated wooden ceiling. In front of the eastern hall there is the western hall, which resembles the eastern one. The old mosque is still preserving the original entrance, which was built 11 centuries ago. The mosque is full of windows, which are divided into upper ones in the higher part of the mosque and lower ones. The minaret is situated in the main facade of the mosque, overlooking Al-Baghala Street. It consists of 1 floor and has no paintings.
Ladies and gentlemen, it's truly a very nice chance to meet you through this nice program. I hope I can express myself and you can accept my talk this time. The talk today will be about acne vulgaris. It's something mandatory for us all to know that no one person passed through the age of puberty without development of some lesions of acne vulgaris. It's well known again that acne vulgaris, though it is very popular among the teenagers, it's very common among teenagers, yet it can occur in the neonates and it can occur in the elder and eldest people. Why should acne vulgaris develop during the time of puberty? Why should it have a lot of troubles and complications and a need of therapy, urgent need of therapy during this time? It will be shown very soon, but I should just clarify to all of you what's acne vulgaris. If I imagine some basin that has some water poured inside it, and this water comes out through a hole, the relation between the hole of going out and the hole or the input of this water in this container will develop. Either it will be full or it will be empty. So I have a lot of grease glands. These glands present in the face, in the chest, shoulders and the back. Why these grease glands or the sebum glands or the glands that secrete sebum? Why these glands are present in such areas? I don't have any such glands in these palms or in the soles, but I have them in the areas exposed to air drafts. I have them present in the areas where I should lubricate my skin to trap bacteria, to trap fungi, to trap toxins in this oil that comes out on my skin. And when I wash my face, I find that I'm able to get rid of this oil that contains all these remnants or these dirts or these bacteria that I should get rid of them. So the sites of acne are the same sites of these glands: the face, shoulders, chest and the back. During puberty, there is some change in hormones between the androgenic hormone and the other hormones, and by the rise of the androgenic hormones and some related hormones, by this shower that comes by the order from the pituitary to initiate the process of puberty, through this process a lot of hormones show new imbalance, new stage of changes of these hormones in the body. And again, there is associated psychological status that occurs in the puberty. In puberty, in the adolescence, we find it that girls and boys usually feel shy, they are a bit disturbed to some extent, they are psychologically disturbed. So we have a lot of factors that increase the secretion of sebum through these glands, hormonal imbalance through puberty and adolescence, and what's more important than this is the psychological status that occur during this time. And if they are exposed to work, exercise, or to go outside, or to dust, or external factors, these glands are closed. If these glands are closed, the secretion will accumulate inside these glands, so they will form the first stage of acne vulgaris. Acne usually appears as little pimples containing pus, sometimes as blackheads or whiteheads. I think it is clear now that the blackheads are just the opening of the closed seborrheic gland, or this gland, sebaceous gland, that's closed, and it's closed with sebum plus the dirt and the oxidized material and some bacteria or something coming from outside. So it usually shows what we call the blackhead. If these stages develop and the patient doesn't need or doesn't seek for good medical help, these sebaceous glands will increase in size more and more, they contain more secretion, and the bacteria comes inside them, and some liquefaction with pus, and the person may press over it and the pus comes outside. If it is deeper, most probably these glands will form cysts. The problem is that cysts, as we are going to tell you during the stage of discussion of treatment, it will be difficult to manage because it may leave some scars in the face or some disfigurement in some areas in the body, especially that are the sebaceous glands are abundant in such areas. I think it's important for all individuals, for youth especially, that have acne vulgaris, to put in their mind that if I just wash my face thoroughly, if I dry my face thoroughly, if I avoid exposure to dust, external factors, and the cleansing of the face, and the cleansing of the sides of the sebaceous glands, if I put this in my mind, I'm going to open these pores to allow the grease to come outside, to have its help, to have its use to my skin, rather than to have its side effects or its complications of being inside, kept inside the skin. So it's just important for all individuals that have acne to wash their faces more frequent than they were accustomed to do. The second thing is that we usually use for a long time with a small dose. Why should we use these special drugs? Just because these drugs, we don't use them in the dose as an antibiotic therapy, but we use them because they change the fatty acid components of these glands. They make them more liquefied and they come easily outside from the skin. It's important again to know that we usually treat acne vulgaris according to its stage. If it is just comedones, we can express them with a comedo extractor and the patient will be cleared on the spot. Now remains an important question through our days, our holidays of fasting. Do I recommend patients of acne vulgaris to fast or not? I think it is mandatory for them to fast. It helps a lot to regulate diet, and I think you noticed that I didn't mention the role of diet in treatment of acne vulgaris at all. I do remember about a quarter of a century ago, or even third of the century ago, we were accustomed to prescribe patients to avoid or to stop oily meals, fatty meals, chocolate, carbohydrate, and so on. We don't recommend this now. We recommend just a regulation of diet. Regulate your diet. If you fast, you regulate your diet, and your acne, I think, will improve with other lines of therapy. Thank you very much.